No. Glad I adjusted you first. I'm like,
the hips sink just a little bit more. Oh, we just have to get a little bit further.
Thanks for watching, guys.
All right, you said left SI joint. All right, let's start from the bottom. Let's see what the tailbone is doing. Let's see if there's an anterior inferior sacrum with leg extension test. So lift your right leg up in the air. Good, down, left, down. They feel pretty equal to you? One more time, right, down, left, down.
A little harder on that side.
On the left side, yeah. Yeah, lumbar fired nicely on the right side. Left side, a little bit more of a hypertonicity on the right lumbar spine. All right, let's do this. Let's see what the coccyx says. We're gonna do these here. Yeah, so right here, anterior inferior on the right. See how this goes here. Come up here. You can see that the heels are tractioning differently, and that left heel gets closer to the butt than the right one. All right, so that's the right. We'll start on the right side. It might be both times because it was left last time. All right, so Doc, I'm going to start with the tailbone, okay? All right, so here's your sacrum right here. Here's your SI joints on the right. S2, S3, S4. First coccyx segment right there. Okay, here's the second, third. We're going to contact the, what's the ligament called? Issue.
Which one are we talking about?
The sacrotuberous ligament. Let's contact the sacrotuberous ligament here on the right side. We're going to traction here and move it into this direction like that. We're going to contact the corresponding fiber in the occiput on the right. Right there. Just feel pretty gross up there? Not bad.
Not terrible.
So we're just going to hold this point on the occiput. Tension's going up and in like there. And hold the sacrotuberous ligament like that. Nice gentle breathing. We're sinking in. This is a tonal adjustment. Coccygeal plexus is down here and all that parasympathetic tone, trying to activate the parasympathetic tone. Hit the brakes on the sympathetic tone. And that fight or flight, anxiousness, relief. Hook up the rest and digest. There it goes. Okay, hold on. See, now that little release right there, you can go a little bit deeper. That's better there. Now, recheck. Let's see. Aha. Now, the left one went down further. So it does have to be. Last time I only did it on the left side because I'm pretty sure I did it on the left side because I didn't know all the indicators that I know now. All right, so we're gonna do the left side of the tailbone here. Working out, Doc?
Why did my booty grow from last year?
What's that?
Did my booty grow from last year?
I don't remember. Yeah, it's so interesting that, it's kind of like my radiology professor used to say, you see what you know when you find what you look for. And like, people are just gonna see what they see. I see a sacrotuberous ligament that's attached from the sacrum to the ischial tuberosity. That's all it is to me. It's a ligament that covers up the coccygeal plexus. But you can't blame anyone for seeing other things. It's just how the brain fills in the gaps. Like if I was like, what the are you doing? Stop fucking around. Right?
I mean...
You heard that, right? You hear it.
Yeah.
Why? Because your brain fills in the blank. But I didn't curse. I did not say any curse words there. But your brain fills it in with what it already knows. It uses context clues. So it's okay that people see this as for what it is, but The fact of the matter is that if you think I'm playing with the butt right now, then you don't know how to play with the butt. This is not a romantic, sensual thing. It's happening. I did this to my aunt the other night.
I heard.
We just don't see it like that. We see it for what it really is, and that's therapeutic. And if you're afraid to do these kinds of things as a therapist, well, then you're letting your patients down who need it. Actually, we'll just say that the patients who need this won't go to you, because the universe knows where to send people. You know, the universe always sends you the patients who you're really good at getting better, and people who are just a little bit out of your range. That way, you have to learn more things to help them. You know, you have frustrating patients, right? People who are just like, God, I can't get this guy better. You got to learn. You got to learn more things to help those patients. Yeah, that's good. Now, there is some occiput stuff going up here on the left. I'm feeling occiput on the left, so let's check in. The car horn outside tells us that we're done. That's how we know we're going to listen to the universe. All right, now let's check again. Let's see how we're doing here. Now we're good. That's much better. You guys can see that.
Oh, thank God.
Alrighty. Now, are you even left or right?
As far as the tenderness,
Yeah.
they're kind of the same. Maybe the right a little bit more than the left.
Okay, here's what we're going to do. Left short, crosses over, do it again, left short, crosses over, one more time, left short, crosses over. All right, so that says left PI. Well, let's just see. I'm going to use the D'Onofrio technique that you taught me last year.
Favorite.
What's that? Yeah. PSIS. See, like the divot's on the right. Wait. No, that's the divot right there.
The deeper one is on the left.
Yeah.
Is there one on the right also?
Yeah.
That's how it's base posterior.
Gotcha.
If it's flat on that side, it's AS.
Well, if it's a base posterior, that would be this.
Honk.
Now, the other thing that happens when I find, when I was doing this technique that you taught me, and then I just keep track, I go down a little bit further into the SI, into S4, and sometimes I find a fiber, like consistently, like on that PI side, it's almost like, oh, PI, and then I go down here and I'm like, I know it's the ilium if that fiber is fired up. But this seems like here. That's what it seems like. So,
That's a spot.
right now, let's see here.
Oh.
Down. Right hip up. Down. Yeah. This is for muscles, right?
And what else would you use a device like that for?
I'm mixing drinks. It could have been a drink mixer.
Yes, it's for muscle.
See, like, I really, whenever I put someone on the blocks, to me it's almost as like CVP technique, where now you're in traction, and I want to stimulate the SI, all the places where there's all those proprioceptive beds, get those SIs fired up while you're in this, and then the ligaments are like completely in a relaxed state.
This is one of my favorite things to do to somebody who has specifically like acute low back pain of some sort.
Blocks?
Block them and use the percussive around that area. Yeah.
Exactly. Yeah, the blocks was immediately on the acute pain. It's so good. Alrighty, now, let's do trap fibers. This is how we adjust the thoracic spine cord to the trap fibers. Tell me which one's the most tender. Ready? 1, 2, 3, 4, 5, 6, 7.
6.
6. All right, so that's what we said when we were standing. So that tells us T6 is T8, which is going to be the 6th trap fiber is T8 and L4. So T8 should be right here. Here's tender. I push down on T8. Still tender?
No.
It's better, right?
Amazing.
That's how we know. And it already started cracking, which means that's superficial. And we just have to get a little bit further.
Do you see my Italian sandwich?
I'm happy with this.
Okay, also, so, there's really nothing up here of neurological importance according to SOT. But, mechanically speaking, is there something that we can, yes. But not as much, you know what I mean? See, so it's almost just like, that was nothing compared to the one that Deja Net wants us to adjust.
It made my brain happy because it felt good.
Good. Let's check that T1 actually. Right, left, right,
Right.
right. I'm gonna dig in a little bit deeper. Yeah, right there. So this actually wants to go. Translations to the left, correct? All right, so I don't want to push it any more to the left then. Okay, nice, gentle breathing here. Just let that loosey-goosey. Good, loosey-goosey. That was okay, but there's tension, there's tension in there. All right, let's see how we're gonna adjust this L4. See what's happening in C2. This is the 11 brothers system. Everything's connected all the time, everywhere, always. Left or right, which one's more tender?
Left.
Okay, I'm gonna go with PL. Okay, relax your neck. Left, right, left, right.
Right, the same.
Okay, so with PL at L4, we need to adjust the PL at L4. I'm not going to adjust the PI on the left SI joint. So that's the thing, is like you said, traditionally it's always been your SI joint, but it's like...
Well, the area. It could maybe be something else. But that's like, I mean, it could be my right pinky toe for all I know, but that's, I usually feel the pain in the left SI area.
That's a good point, yeah. This is, you overthink reality. This right here.
Me?
Yeah, it's much more simpler. It's much more simpler when you just let it happen. But like, you have to use your power of analysis to solve problems, but you cannot use your power of analysis to create problems to solve. Yeah. Alrighty, okay, let's do this now.
I'm drooling.
Alright, this side up, face me over here. Okay, I'm gonna adjust your L4, okay?
Okay.
See, how's that? Does that comfy on your neck? That's just with the tilt, not with the...
Yeah, it's fine. Do you think it's more comfortable this way or the other way?
I don't know. The way that you had it was super comfortable, so...
That's fine.
Alright, let's see. This is L3. Here's L4. Nice and gentle breathing. Take a deep breath in. Good. We'll follow the next breath out. Good. In breath. Out breath. Sinking in with the hips. Sink just a little bit more.
Always.
Okay, lie on your back.
Oh man,
Yeah.
I needed that really bad. Thank you.
Alright, now this side over here. Okay, now I'm gonna adjust that. Well, the AI sacrum was on this side and an anterior superior, so this whole thing was just like, so we're gonna go the other way. Okay, gentle breathing in breath. Good, just up here. Good. Lie your back. Lie your back. Okay, where was that though? I think that wasn't my favorite, but.
I'll do it again. We do.
One more time. Deep breath in. Yeah, we'll follow the next breath, actually, in breath. Out. Good.
Oh,
Lie your back.
I don't know where it was, but it felt about time.
Turn your head to the right. Back to center. Left. Back to center. Exactly. It's exactly right. I'm not sure. That's why I thought it was the left atlas. I was not. See, then we just have to really just figure this out. Relax. Cut this. Relax. Ooh, man, that's some good extension right there.
You called me giraffe flex, Jerry.
Oh, I'm sorry. It's kind of more ostrichy. Yeah, this is occiput right there. Duh. All right, first let's just get this nice and loosey-goosey. Let it all sink in, breathing. Good. Dropping into the sensation of your breathing. Very good. Feeling the expansion on inhalation. Feeling everything sink on exhalation. So that's what you're in your occiput, Josie.
Honestly,
Right me out.
I don't remember. Did you adjust my occiput?
No, I toggled your atlas.
You did toggle my atlas.
Alrighty. Nice and gentle. You're breathing. We're gonna follow the breath out in this direction like that. You're perfect, doing everything you can. Just focusing on the breath. Good. That's nice right there. One more breath. We'll follow this breath out. Feel yourself sink as you breathe out. That's pretty good. Let me check. You ever hear of toughness technique? Do you ever hear of toughness technique? You know what toughness lens is? It's some old chiropractic mumbo jumbo. Okay, let's say I just did L4. I'm gonna see 2 minutes to go. Okay, nice, gentle breathing, good. Let the head drop in. Let's feel it drop here, a little bit more. Shoulders, hips. Let this go.
Oh wow.
Okay, let me see. Put your right arm up.
Just like straight up?
Yep, make it strong. 1, 2. Okay, bend your knees so that your feet are flat. And then put your hands underneath your hips.
Oh, holy shit. Oh, man. Freaking La La Land.
I need that.
Wow. Ooh.
Come on.
That one never does it. Don't even try. It's like the most stubborn joint on my body. No.
All right, make this strong. Don't let me push it down. Make it strong. Talents to make the cuboid. 1, 2, 3, 4 Canadian forms. Third Canadian form. Calc. Okay. Damn. Third Canadian form. Yeah.
No.
Breathe.
I'm
Breathe.
kidding.
Good job.
I was so prepared. I was so relaxed from the occiput adjustment.
Okay, let's go back out. Okay, make it strong. Don't let me push. Okay, make this one strong. Don't let me push here. I'm not as good as you.
What do you do differently?
A little bit. You taught me. How can I do it differently? Oh, wait, it should be like this?
Use there where you're
No. I could do it like this. Let's see. Make it strong. Ready? Make it strong. Oh. Could do it nice. See, this one is like this here. Speeder boards help. Oh, but you have a thing. This is your femurs internally rotated. What? Oh, you did. You had a supination on your right side, right? Don't you love it when the muscle test it shows up and it works?
Mm-hmm.
It's amazing. It like.
I know, right?
Anyway, that was coming from your femur.
You're gonna have to learn that.
Kind of fat booty that you have on here before you. Oh, me actually. Good. That was terrible. That's better. All right. Push up against me here. Okay, that's good. You ready?
Mm-hmm.
Sucks.
Mm-hmm. Not as bad as my left foot did.
Let's see here. Not as bad over here, right? See, like I can tell what it feels like to you, which means you can too, obviously, is the point. The point is that this one's a little bit more mushy. I have it right there. There's the nodule. It's tender, I know, but it's tiny, which means this is like the backup station. So like, if this is the point for the stomach. So if the stomach's overflowed, then you're gonna feel it here. This is the backup, right? This is the backup for the gallbladder, liver. So this is a big, fat, tender nodule. Okay, so now we have to work on it. A lot of times you just actually have to clear the bowel first. Sometimes it's just better to work on the loose valve first. Short head of the biceps tendon, not too bad, but a little bit. Okay, ASIS here, tracing up to the navel. Counterclockwise both sides. Did I do this at all last year?
You just my stomach.
I like the way this feels here. This feels okay to me. It feels like it's the right amount of firmness. All right, so let's go back to this thing that did not feel great. It's weird, I think, just because sometimes you can just work on it here. A lot of times this is just like the entry point that start to give away. So belly button, 1.5 inches for you, 2 inches, 1.5 inches lateral, 2 inches superior. Good belly breathing. Good belly breathing. Into your belly, fill your belly up. There you go. Good. How's that feel right there? Did you eat anything today?
A little bit.
Yeah, that doesn't feel like much. Alright, put that hand away. Alright, let's do this. I'm gonna do the liver gallbladder pump. Okay, so we're gonna use the rib cage here. Just get this moving over here.
I'm glad I didn't eat much today. Sorry. Sorry. Focused.
What's happening? Oh my God, I got it. You relax. Okay, breathe into your belly. Oh, I'm seeing this one over here now. I'm gonna pull your shirt up a little bit, okay? That one's clear, that's good. Put that away there. Okay, now we're gonna trace at the top of the diaphragm here, over top of the splenic flexure. Good belly breathing. There's just a little bit right here. You're gonna breathe into your belly. Oh man. Yeah, keep breathing. We gotta work this out. This isn't fun. It's the start of it. Hold on. Straighten, hold on. Belly button. Belly. Don't forget to breathe. All right, put this up here. Okay, make this strong. Okay, relax there. Did you shed a tear?
My eyelashes were like smushed for me on FaceTime. But yes, I shed a tear. My parasympathetic nervous system's so happy that I'm tearing up.
This is all root chakra. Did you move recently? This is all root chakra. Did you move recently?
Like where I live?
Yeah.
Yes.
That's okay. That's normal. That's what you want it to be right now. You just moved, so you want it to be the root chakra. All right, hold this up again. All right, push up against me here. Max the love. Palatine, palatine, palatine. TM, TM. Good. Sphenoid, sphenoid. Frontal, sagittal, temporal. All right, a little bit of sagittal. Not too out.
I love you, but I hate that.
All right, bend both your knees. All right, you're gonna squeeze my fist as hard as you can. Squeeze. There you go.
Already moved.
Okay.
Yeah.
All right, let me see here. Put your legs down. All right, push against my hand right here. Lower, lower, upper, 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 shoulder. Can I do a sit up here? Now look straight ahead. Let that go.
Ooh. You got that one good. That hasn't been adjusted in a while.
Well, it showed up on the muscle testing. You know what I mean? It's, no one's going to be good to push up against me here. Like, there's nothing on the muscle testing otherwise. Like, can I make it crack? Maybe. But did it want me to do it? No, this is good. You don't need to do this. This is fine. Put your hands on your hips. Okay, push your elbow back against him right here. Oh, that one, right? Push here. Nice. See, do you see how less aggressive it is?
I like being aggressive though.
All right, bring your chin down to your chest. All right, we're gonna bring this up here like this. Let that relax here. Loosey goosey. Good. Good. This one on the right. This one here. Okay, I'm gonna crack your skull.
I wasn't ready for it.
Man, right to the fetal position? You sense like some emotional trauma here, Dr. Shelly? Were you emotionally traumatized to your ear?
Probably. Now I am. Sorry. Mustn't have heard ASMR video. I'm ready for it. It's good though. You know, just like there's some adjustments that are just, you know. It was fabulous. It's just me.
I know.
It's a lot.
All right, put this out here. Push up against me. There, relax. See, this is where I find the divot on the sphenoid. You do a lateral canthus, and then you just pull back from there. You'll find one side's a divot, and one side's all junked up. The divot side's posterior, it needs to go anterior. And you can just check superior and inferior, get the toric in there too. And holding. Work the breath. Cranial adjustments are achieved with the respiration. Restoring the cranial rhythm, establishing high optimal efficient pumping of cerebral spinal fluid, bathing the central nervous system. Good, the left arm out again. Push up against me here. Right up. Oh no, not that. Put the right arm up. Push right here. Where is it? Right on your back.
Not the
But again,
Yeah, dude. Wait,
No.
is it the put your legs out. Is it this one? Here, make this strong. Make this strong. Hi. Good, then relax. Oh, it's right there. I swear to God. Oh. Okay, make this strong right here. Okay, let's do sit up here. Good, so your legs that way. Okay, put your left arm out. Push up against me here. Right down. Good, there, relax. Right arm out. Put up against me here. Those weren't even words. Good, relax. All right. 2 more things. Lie on this side, face over there.
Underneath me.
Okay, this is mirror image adjusting.
Okay.
Pressure good?
I can't hear anything right now.
Pressure good?
I think so.
So technique overlaps. Last time I did toggle your atlas on the right, which is what needs to happen in a CBP perspective. With your head's translated to the right now, so this is the mirror image of your translation. Okay, lie on your belly now.
I'm pretty sure I made the same exact when you adjusted me like that last year.
Well, then if the audio doesn't work out, we can just use
We can
year's
just
audio.
decide.
Okay, nice and gentle breathing. This isn't really, the initial intention of this was not ASMR. It just happened to work for ASMR.
Isn't that like most chiropractic videos show in general?
Yeah, like not intentionally ASMR. Yeah, well, non-intentional ASMR is different than intentional ASMR.
Would you say your videos are intentional ASMR or?
They're definitely intentional
Intentional.
ASMR. They were unintentional in the beginning, and then I studied ASMR, and I was like, how can I make it better ASMR? But the shirt rattle was always shamanic. This was always a practice of sound meditation. Because sound is the vehicle that our consciousness rides through the moment. Just like using your breath, we're just using the sound to keep us present. Keep your mind out of the anxieties of the future, making all your to-do lists, all your equations that you're trying to solve all the time.
Who does that? I don't know what you're talking about.
And it keeps your mind out of the past, of the shoulda, woulda, couldas. It's all right here, right now. And the now is the most potent time to actualize your intentions. I know they call it manifest your reality, but I think that's overdone these days. I think actualize your intentions because you need action. But it starts with an intention. You still have to do it. You don't just make things into thin air. Although the universe is unconditionally abundant to your intentions, as long as you're aligned. Physically, mentally, spiritually. The now is the only time you are truly alive. The only time your consciousness is unfolding. The past and the present are just concepts. They're useful concepts. But the now is the only time you are ever truly